Hello, my name is Yechiel Bolatov. I am Medsims manager. Medsim is an innovative manufacturer of ultrasound simulator system, the Ultrasim. The Ultrasim has been manufactured by and developed by doctors and aviation world experts for over 15 years, and it's been installed in a variety of locations around the world, from the US to Asia and Europe.
Hello, my name is Denise Levine. I work for Medsim. I am the Senior Clinical Application Specialist, and I'd like to demonstrate the Ultrasim. I'd first like to tell you a little bit about the system. The Ultrasim is a fully simulated ultrasound system and has all the features and functions as a real system. We offer 12 types of modalities and numerous cases, normal cases and cases with pathology. There are many educational training features within the Ultrasim, which include detailed clinical data information, which is the patient history. We also have symptoms and signs of the patient, how the patient is feeling. We also include the case analysis, the findings of the doctor. I would now like to show you some of the system to show you the benefits and how the system actually works. The clinical data has many folders. First folder is patient history. Yes,
I missed my period last month. It should have come on the 15th, but I still haven't gotten it. I often skip a month.
Has many folders, has family history, symptoms, and the report of the patient. I'd next like to show you the demonstration on the system. The transducer is a mock ultrasound probe and has a sensor within the top of it. There's a 3.5 megahertz probe. We also offer a 5.0 transvaginal ultrasound probe and a 7.5 linear ultrasound probe. The system helps guide you on how to hold the ultrasound transducer. One of the advantages is you are able to see professional images. And with showing the professional images, I am able to show you the orientation of the transducer itself. This is how the professional held the transducer, and this is myself trying to find the correct orientation of the image. When I get closer to the scanning plane, the image will turn gray. As a student, you are able to store images in the system. As an instructor, you can compare the student's image to the professional to student image. Now this shows you how the student held the image, the transducer, and this is how the professional held the transducer. The system is task-oriented, meaning that this is the name of the case: gynecology, uterus, and ovaries. This is the reason for a field exam. Each case has one of many tasks. This particular case has 1 of 17 tasks, meaning that the student can be self-guided and can learn on their own. An instructor does not have to be present with the student to scan. The students have the ability to store their images. They also have the ability to interpret their own images. As an instructor, you are able to disable certain features and allows the student to use the same case over and over, not knowing that they had used the case previously. There is also an image library. Students have the ability to look at the image library. As an instructor, you are able to disable this feature so the students are not able to see that. This would be for more advanced students. We also have the case analysis, the doctor report. Within the doctor report, there are images that you are able to obtain to see that the student did the correct image. There are many ways that the student can compare the professional image and the professional image is compared to the student image. This way it allows the instructor to know if the student is doing the image correctly. The system gives the student the ability for hand-eye coordination. They're able to hold the transducer in the proper orientation and will feel comfortable, as it is not a real patient on the table, so they have the ability to work as long as necessary to have the comfort of using an ultrasound system. As an instructor, you are able to see the student's performance. The chart allows the students to see the student's progress. But this is the professional images, and these are the student images. There is a timeline, so it tells you how long it took to acquire each student image. This allows the instructor to see that the student is progressing in the right direction. There's also a chart. All the purple shows activity, so it shows when the student did what feature at what particular time. Did they look at the clinical data, the patient's history? Well, you shouldn't be looking at it at the beginning. If purple is activity and it's looked at over here, it should not be, the student did not do this examination properly. In closing, the ultrasim offers many benefits. As a student, it gives you hand-eye coordination to use a transducer. It also gives you the ability to scan the same patient as long as necessary without the patient being uncomfortable, since the patient is a mannequin. You also have the ability to see normal cases and cases with pathology. The cases on the ultrasim are real patient cases, so they are simulated within a simulator. I hope that this demonstration was a little piece of the ultrasim. Thank you.
Thank you for being with us and looking at the demonstration by the ultrasim. You may contact us directly through our website at www.medsim.com or via one of our worldwide distributors. Thank you.